Hi there. Just want to make sure. Hi there. My name is Victoria. I'm a nursing student at Southern New Hampshire University, and I'm going to demonstrate today how to do a head-to-toe assessment on a patient. Here is my volunteer patient. Thank you for doing that. For the purpose of this video, I'm not gonna say the full name of my patients, just initials. Can you please tell me your first and last name and date of birth?
NP, March 10, 1993.
Okay, so before I'm gonna start my assessment, I wanna make sure that I'm gonna wash my hands. The first thing when I'm starting an assessment, I'm looking at patient general look, see how he looks, and I'm starting my assessment with skin. When I'm looking at the skin, I wanna touch and make sure the texture is normal. It's not dry, it's not diaphoretic, or it's not edema anywhere. I'm gonna check for turgor, make sure the patient is hydrated. I'm gonna do the same thing on a leg, skin. I wanna make sure it doesn't have any discolorations. The next thing I want to look at the patient's fingers, make sure that doesn't have any arthritis, so the joints are not deformed. I'm gonna look at the nails bed, make sure it's pink and it's not cyanotic, which might indicate like a problem with oxygenation. I'm gonna do the same thing on this one. So while I'm doing this, I might as well check for the capillary refill and make sure that it's less than 3 seconds. And this is like, it's a normal. This is how it's supposed to be. Yeah, I'm also looking to make sure that the hair is evenly distributed on a patient's arms and legs, and there is no shiny like patches with no hair. The next thing I'm gonna do, I'm going to check the patient's hair, but not before I'm gonna wash my hands since I touched the patient's legs. So I'm going to look at how the hair is distributed, and it looks evenly distributed on a hair, on a head, on a scalp. I'm looking for any lesions, wounds. I wanted to make sure there is no patches of alopecia, where it's no infestation. And since sometimes in men with the beard, we also want to make sure that we take a look at the beard and make sure there's no infestation there either, or any wounds that might be covered by beard. And everything looks fine, the texture is normal, there's no dandruff, nothing like that. Next thing we're gonna do, we're gonna take a look at the patient's eyes. So what I'm gonna check when I wanted to look at the patient's eyes to make sure that I'm gonna look like externally and looking at the eyelids, make sure there is no edema or no puffiness. I'm going to look at the sclera, and it's white, it's not red or yellow, it's not jaundice. I'm looking at eye brushes, and it looks fine. Now I'm going to take a look at the patient's pupils, and what I'm looking is to make sure that they are they are equal, round, and they constrict, and they also accommodated. So I'm gonna flash into your eyes. Could you please look at the wall, like pick up a point on a wall and just take a look there? And I would say 3 millimeters each. They're equal, reactive, and this is a normal finding. We want it to be between 3 and 5, which this patient has. So next I'm going to take a look at the patient's accommodations, like vision. Can you please take a look at my pen light? And I'm going to move it towards your nose, and I want you to follow with your eyes no your head or nothing, just your eyes. Okay, I don't see any nystagmus. The next thing I'm going to check is the patient's cranial nerve 3, 4, and 6. And I'm going to see if the patient is following the pen light and there is no signs of strabismus. So I wanted to follow your my pen with your eyes, okay? Just the pen. Okay, everything looks fine. The next thing I'm going to check patients to see the peripheral vision. So I want you to cover with your palm your right eye, please. And you want to tell me when you see my pen light.
Yes. Yes, I see. Yes. 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 Yes.
Do the same thing with the other eye.
Yes. 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 Yes.
Okay, thank you. Now I would check the patient's Snellen chart, but because we don't have any, I'm just going to explain how to do it. So basically, patient has to cover his eye. He's going to stay 20 feet away from the chart, and the chart is going to have letters big and small on different sizes, and he just have to read the letters from big to small, and then it's going to be compared with the 20/20 vision on a normal person. Next thing, I'm going to take a look at the patient's neck and face. So I'm going to check the sinuses. I'm going to start with the maxillary and temporal. Do you have any pain?
No.
I don't feel any swelling. Now I'm going to check patient's neck. When I do the thyroid gland, can you please swallow for me? Okay, trachea is midline, looks normal. Now I'm going to check temporal arteries. Okay, looks fine. I'm going to do carotid artery. I'm going to do one at a time. I never want to do both at the same time. Okay, I'm going to have you open, I'm going to check TMG, and I want you to open your mouth a couple times, close it. Okay, I don't see any deviation. I don't hear any clicks. Can you please move your jaw side to side? Okay. I want you to open your mouth against my hand. Okay, close it. Now I'm going to listen to your arteries, and I'm going to check this with the bell of my stethoscope. Okay, I couldn't hear anything abnormal, no bruits, nothing like this. Now I'm going to look at the lymph nodes and make sure the patient doesn't have any like lymph nodes swollen, nothing like this. Parotid, like behind the ears, in front of the ears, and clavicular over here, and axillary. Sorry. Okay. So the next thing I'm gonna do, I'm gonna check the ear, external ear. I'm looking to make sure the texture, there is no lesions, no deformities, no abnormal, no tophi, nothing like this. If I would have an otoscope, I will look into the patient's here to make sure the eardrum is intact, and also to make sure there is no extra wax, which might make patients hearing a little bit the patient might not hear that well with extra wax. Now I'm going to do check the cranial nerve 8, which I'm going to do a whisper test, and I'm gonna have you cover one of your ear. I'm gonna say 2 words to you, and you have to tell me back what those words are. Okay?
Okay.
Start with your right ear. So I'm gonna say
Cat and dogs.
okay. Do the same thing with the other.
Okay. apples and banana.
And that is correct. Thank you. Now I'm going to look at the patient's nose. When I look at the nose, I want to make sure that the sepsis is midline, there is no deviation, there is no obstruction, and person can smell well. And I don't see anything, can breathe well. And I don't see anything like no bleeding there, no obstruction, nothing. I'm gonna have you cover one nostril and please breathe in. Try it with the right one. Okay, do the same thing with the other one. Did you feel any obstruction? Can you breathe okay?
Yes.
Okay. Now what I'm gonna do, I'm gonna have you cover one nostril and close your eyes. And I'm gonna check the cranial nerve 1. The smell, make sure the patient smells fine. Let's start with your right one. Okay. What is this?
Smell like a lavender.
Yep. And do the same thing with this one. What does that smell like?
Like a citrus.
That is correct. Now I'm gonna check for to see your sensation. So this is a dull, this is sharp. So I want you to close your eyes and I'm gonna go on your face and touch different spots, and you have to tell me if it's dull or if it's sharp, okay?
Okay.
Can you close your eyes please
Yes.
for me? So, what is this?
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull.
Okay, perfect. Open your eyes. I'm going to check, now I'm going to check the mouth. When I check a patient's mouth, I want to make sure there is no lesion inside, that the tongue is not dry, and no thrush, and no yellow, nothing like that. So I'm going to have you open your mouth. Okay. And I don't see anything like that. The cavities are looking fine, no lesions inside the mouth, and the tongue looks fine. There's no red beefy, which might indicate anemia. So now what I'm gonna have you do, we're gonna check for cranial nerve 9, 10, and 12. I'm gonna have you stick out your tongue. Stick out your tongue. Just and say okay. Move side to side, up and down. Okay, thank you. And if I would have a depressor, a tongue depressor, I would check for the gag reflex. But I don't have it today, so this is like I would usually put it back in the throat, and I will see if how is the patient's gag reflex. Now I'm going to check for cranial nerve 5. And I'm gonna have you clench your teeth, like, okay. I'm gonna check over here, okay. Now I'm gonna have check like cranial nerve 7. Can you please puff your cheeks? Okay, purse lips, like this. Okay, smile. Close your eyes tight. Okay, perfect. So after we do this, we're gonna, so while patient is sitting like this, I might as well check for GVCs, jugular vein distension. So put your head at the 45 degree, and I'm looking over here, and I want you to look at the same part over here, and everything looks fine. Now, since the patient stays in this position, I'm going to check for the head range of motion and shoulder range of motion. So put your head backward, like, okay, your head like this, look up, look down, side to side, do rotation with your head, okay, shoulder to head, the same thing on the other, shrug your shoulder, okay. Thank you. Now what I'm gonna do respiratory system. So I'm gonna have patient, can you please turn your trunk towards the wall. So first thing I want to look in general and see how the patient's thoracic cavity looks, and it looks fine. I don't see any accessory muscle used when respirate. I'm gonna touch as well and make sure that both sides are symmetric. Can you please breathe for me? Breathe in and breathe. Okay, and I don't see anything like this. No tachypnea, no dyspnea on exertion or on rest. Now I'm gonna check for fremitus. Can you please say 99?
99. 99. 99.
Okay, and we'll check it on front.
Also 99.
Mm-hmm.
99. 99. 99.
Okay, thank you. Now I'm gonna check for, I'm gonna do palpation, and I'm gonna, not palpation, sorry, percussion, and I'm gonna start with the front. And it's resonant, as it's supposed to be. Gonna do the same thing on the back. Okay, now I'm gonna listen patient's breathing sound, and for this I'm gonna use the diaphragm of my stethoscope. Can you please give me a deep breath? Okay, I'm gonna listen to the front. Okay. No adventitious lung sound, no lung sounds clear. There may be a time to ask a question. Are you a smoker? Do you ever smoke?
No.
Okay. Now I'm gonna do the cardiovascular system, and I'm gonna start with the heart sounds. I'm gonna do the same thing, but I'm gonna listen with the bell of my stethoscope. So when we listen to the heart sounds, we want to do it in this order: apical, pulmonic, Erb's points, tricuspid, and mitral valve. So this is the way, this is the order how we're supposed to do the heart sounds. Thank you. And there is no murmur. The reason why we listen to the bell, we want to make sure there is no murmur or no abnormal sounds. So now I'm gonna have you lay down, and we're gonna do gastrointestinal.
Okay.
We're gonna finish the cardiovascular system, and we'll do some range of motion as well. Okay, so when we do gastrointestinal system, we were gonna do things a little bit different. We wanted to start with inspection, and then auscultation, then percussion, and then palpation. So I'm looking at the patient's belly. It looks fine. I don't see any ascites. I don't see any hernia or protrusion, nothing like this. It looks flat. And I'm going to start listening with my diaphragm. And the order I wanted to do it, it's start in a lower right quadrant and move towards the clockwise. we wanted to listen in like 1 to 5 minutes usually to make sure that we can hear some peristalsis. In this patient, the peristalsis are sounding normal. Now I'm going to do percussion. And it sounds tympanic as it's supposed to be. If we suspect the patients might have enlarged liver, we wanted to do liver percussion as well. And we're gonna start on a third intercostal space, and we're gonna move down. So this is where I start feeling dull. So if I would have a marker, I would mark right here, and we have to move from lower to up, from starting on umbilicum. Okay, and this is what it is. So this is where I will mark my margins for the liver, and see if it's not enlarged. And I will do the same thing with the spleen. So spleen is located in anterior, under rib cage, anterior axillary line. So I'm gonna percuse that, make sure it's not dull. So while the patient's sitting in this position, we're gonna also do the palpation, and I'm gonna palpate. Are you feeling any tenderness? No pain? Okay. So we're not gonna do in this assessment, but normally we would like to do a deep palpation as well, and the way we do it is just ask the patient to take a deep breath, and we go like as deep as like 2 to 3 inches, and we can do the same thing for the liver and for the spleen and for kidney to make sure there's no problems with these organs. Now, well, in this position, I'm going also to here for radial pulses, okay, brachial pulses, okay, popliteal, dorsalis pedis, and posterior tibial. Sorry, I couldn't find the word. Posterior tibial on both legs. Okay. I also wanted to here for the aorta, renal arteries, and femoral arteries. And what am I looking at for some bruise, but I couldn't get anything like this. So, and we want to do it with the bell of the stethoscope. I'm going to have patient to do some range of motion of the lower extremities, because my patient's a little bit tall, so we probably wanted to do it while he's laying down. So I'm gonna have you flex your knee, flex the knee, yeah, and bring it up to your chest. Okay, now extend, extend, extend back. Do the same thing on this one. Extend, yeah, yeah, thank you. Now I'm gonna have you bring this leg up and down, this one up and down. Now do abduction like this, and then bring it down, back. Abduct, adduct, adduct, yeah? And the other leg. Now do the same thing, but cross the midline, please. No, 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 just cross the midline like this. Okay, thank you. Now I'm gonna look at the patient's feet. I'm gonna have him do the same thing. Can you please plantar flex, like, yeah, dorsiflex, okay, inversion, aversion, okay, curl your toes, straighten, okay, now push on my hand, push towards your nose, push, invert, avert, okay? And I would say 5. And this is, we check for the strength. And I forgot to mention when I did the patient's pulses, they were strong 2+, which is a normal finding. So now I'm gonna have you stand up. Can you please stand up?
Yes.
Okay. While you're sitting in this position, I would like you to come here over here, please. Yeah, I'm going to finish my musculoskeletal assessment. So try to touch your toes with your hands. Thank you. And now try to bend backwards a little bit. Now go side to side. Now go in circle. Okay?
Yes.
Thank you. Now with your hands, I want you to put your hands in front of you, like extend. Okay, up, lateral, down. No, down to your body, and now go down, and now go all the way like this, up and down. Okay, thank you. Now I want to see your hands. Okay, we're gonna check for elbow. So show me supination, pronation. Okay, spread your fingers. Okay, do like this. Okay, now put your hands up like this. Okay, okay. Now don't let me push your hands down. Don't let me push you up. Okay, don't let me push them inside. Don't let, okay, side. Okay, make a fist. Okay, and up, down, inside, outside. Okay, now put your hands up like this, like you were trying to cover yourself. Push towards me, pull back, push inside, push outside. Now put your hands up like this. Don't let me put your shoulders down, up. Okay, perfect. I'm going to have you sit on a chair. Yeah. Try to bring your head, your leg, like don't let me bring it up, okay? Don't let me push it down. Don't let me bring it up. Don't push it down. Okay, thank you. Now I'm going to check for motors. So what I wanted to do, I wanted to go down your shin, starting from your, with your heel, starting on your knee. I wanted to do on both legs. Go down your shin like this. Okay, looks perfect. Now I'm gonna have you touch my finger and then touch your nose. Do the same thing with the other arm. Okay, stand up. Close your eyes. Gonna check for balance, Romberg test. Now sit down, please. I'm going to check for the patient's like feeling on legs and see like sensations. So I'm going to touch like previously, dull and sharp, okay? Close your eyes, I'm sorry. Close your eyes.
Dull. Dull. Sharp.
What was this?
Sharp.
Okay.
Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Dull.
Perfect. Thank you very much. One more thing that I kind of forgot to do last time. Do you mind laying down for me for a second? Lay on your left side, please. On the left side. So, and come face me this way. Going to check for PMI. Thank you. Stand up, please. And if you don't mind, just taking a seat over here, here. So I'm going to have you close your eyes, and I'm going to draw something on your hands, and you have to tell me what did I draw. It can be a letter, can be a number, and this is this test is called
Which one?
graphesthesia. So I'm going to start with this sound. Close your eyes.
Gate.
Okay. Close your eyes. And give me the other arm. Give me the other arm. Close your eyes. What is that?
1.
And don't open your eyes. I'm going to put an object in your arm, in each arm, different object, and you have to tell me what is this. This test is called stereognosis. What is this?
It look like a battery.
Okay. I'm going to do the other arm. Okay, just one arm at a time.
Look like a pen.
Okay. It looks or it feels.
Yes, sorry, yeah.
Okay. So now I'm gonna have you open your eyes, and if you wanna come here next to me, and we're gonna do some tests, and I'm gonna have you walk across the room. Yeah. Okay. Now come back and walk heels to toes. Now go back and like fast go on your tiptoes. Okay, now come back on your heels. Okay, perfect. Do you want to take a sit, please? And I'm going to have you, I'm going to give you some questions. First of all, where are you today? Can you tell me what place is this? Where are we at today?
I'm in Shadow Hospital.
Yep. Do you know what day it is or what month it is?
Yes, it's June 10, 2022.
Okay, do you know who's the President of United States?
Yes, Joe Biden.
Okay, and he's alert and oriented ×3. Now I'm going to have you tell me what did you do for your birthday last year?
I was outside with my family, with my friends, to celebrate my birthday.
Okay, and I checked for the long memory to see the patient's long memory. Now I'm going to have you count for 30 seconds. I'm going to have you count from 100 down by 7.
By 7. 100.
Mm-hmm.
93. 86.
Mm-hmm.
79. 72. 65. 50. 58.
Okay, that's
50,
enough.
52.
Yeah. I'm gonna give you one paper, and you have to like fold it and put it on the ground for me, please.
Put it on.
Fold it and put it on the ground.
Sorry.
Okay, thank you. And now I'm gonna have you. I'm gonna say 4 words, and then I'm gonna do one more test, and I'm gonna have you repeat those words at the end of that test. Okay?
Okay.
So, cat, lamp, orange, and lake. Okay. Now I'm gonna have you count down by 20, starting from 100.
100, 80, 60, 40, 20, 0.
Okay. And can you please repeat for me those words that I told you like a little bit ago?
Yes. Cat, dogs, orange, legs.
Okay, so I did say cat, lamp.
Sorry.
Yeah.
Cat, lamp, orange, leg.
Yeah.
Legs.
You're a little bit nervous?
Yes. Sorry, yes.
Okay. So I guess this was all assessment for today. Thank you so much for being here with me again.
Okay.
And thank you for everything.